and diagnosis. Welcome back. Today's topic is HSG. Hysterosalpingography. Hysterosalpingography, or HSG, is an X-ray test to outline the internal shape of the uterus and show whether the fallopian tubes are blocked. In HSG, a thin tube is threaded through the vagina and cervix. A substance known as contrast material is injected into the uterus. Anatomy. The human female reproductive system contains two main parts, the uterus and the ovaries, which produce a woman's egg cells. The human female reproductive system contains two main parts. First is uterus, hosts the developing fetus, produces vaginal and uterine secretions, passes the anatomically male sperm through to the fallopian tubes. Second is ovaries, produce the anatomically female egg cells, produce and secrete estrogen and progesterone. Why we done this procedure, that is indication. First is infertility. The cause of infertility may be difficult to determine but may include inadequate levels of certain hormones in both men and women, and trouble with ovulation in women. Second is recurrent pregnancy loss, RPA, also referred to as recurrent miscarriage or habitual abortion, is historically defined as 3 consecutive pregnancy losses prior to 20 weeks from the last menstrual period. Third is, the types of congenital uterine anomalies include septate, a normal external uterine surface but 2 endometrial cavities; biconuvate, an abnormal indented external uterine surface and 2 endometrial cavities; arcuate, a normal external uterine surface with a 1 cm or less indentation into the endometrial cavity. Fourth is, suspected case of genital TB, in most cases. The disease is asymptomatic or can present with a few symptoms, among which infertility is the most common. Other symptoms reported are menstrual irregularities such as oligomenorrhea, hypomenorrhea, amenorrhea, menorrhagia, dysmenorrhea, metrorrhagia, pelvic pain and abnormal vaginal discharge. When we can't perform this procedure, that is contraindication. First is, acute PID is when there is sudden or severe inflammation of the uterus, fallopian tubes, ovaries and pelvic area due to infection. Sometimes the inflammation can persist for a long time. This is known as chronic pelvic inflammatory disease. Second is active vaginal bleeding. Vaginal bleeding is the periodic blood that flows as a discharge from the woman's uterus. Normal menstrual vaginal bleeding is also called menorrhea. The process by which menorrhea occurs is called menstruation.